wild guess and assume that you have sciatica. What is sciatica? Sciatica is leg pain. Pain, a pinched nerve, the sciatic nerve, running down the back, through the glute, through the butt, deep in the butt, running down the back of the leg, all the way down to the foot. Now the sciatic nerve is the largest nerve in the human body. At its thickest point, it's as thick as your thumb. Now, the sciatic nerve technically is 5 nerves. So 5 nerves that exit from the spine, from L4, L5, your first sacral notch, second and third sacral notch. And that nerve, those 5 branches form deep into the glute, the sciatic nerve, and run all the way down the leg. Now sciatic nerve pain can be leg pain, it could be sharp pain, it could be dull pain, it could be burning pain, it could be numbness and tingling into your foot and into your leg as well. Now, let's get into some stretches on how you can alleviate sciatic pain. But first, what causes sciatica? Well, it's caused by 2 things, one of 2 things. It could be both, but usually it comes from the spine. Now, it could be a few different things in the spine: a disc herniation or bulge, an arthritic spur, or spinal stenosis. And I've done some other videos on disc herniations as well as spinal stenosis, so be sure to check those out. But the second thing that can cause sciatica is piriformis syndrome. Piriformis is a muscle that attaches right in the glute region and then on the inside of the sacrum, and that's why sometimes that sciatic nerve, one of those branches of the nerves, can get caught and trapped in the piriformis muscle. So if you have sciatica due to piriformis muscle, which by the way is less often, it's usually coming from the spine. I'd say about 85% of the time it comes from the spine. The other 15%, the piriformis muscle. And you're going to find out today if these stretches and exercises after a week or 2 get rid of the problem, you're good. It's the piriformis syndrome. But if it's not alleviating, if it goes away temporarily and it keeps coming back and it's just not getting better, it's coming from your spine. Make sure you go see a great chiropractor. Cox flexion distraction technique is the gold standard for disc herniations pressing on the sciatic nerve. But let's get into it. Let's do some stretches for leg pain and sciatic nerve pain. The first stretch, we're just going to try to get some range of motion in the sacral and in the glute buttock region. So we're going to bring the knee to the chest and across to the opposite shoulder, and we're going to do a couple of light impulses here just to open up the foramen where the nerve comes off from the spine. We're going to do 10 repetitions, and then we're going to hold it for 30 seconds. There we go. And you want to make sure that you do this bilaterally on both sides. And then after we do that, we're going to place this foot lateral to the knee, and we're going to do the same thing here. We're just going to do 10 impulses just to open up that foramen, stretch out the muscles in the glute region, including the piriformis. There we go. Now, we're going to hold it for 30 seconds with the foot planted down, lateral to the knee, as you can see here. Good, and you might notice one hip is tighter than the other, one side's tighter than the other. It may not necessarily be the side that you have sciatica on. Make sure you do both sides. And then after we do that, we're going to take the left leg and we're going to bend it up, keeping my ankle right where it is. And we're just going to do 10 impulses here. We're going to push down on the knee here. And you may feel a little bit of this stretch also in the front right through here, in the iliacus area. And then after 10 impulses, you're going to hold down, straighten this arm out, and push this leg down towards your feet. If this isn't a good enough stretch for you, what you can do is you can grab your ankle and pull it towards you like this. And you can also bring this foot closer to your body. And we're going to just go a little bit deeper into the stretch here. And like I said, hold that for 30 seconds. Great. And then we're going to go ahead and do the other side. Knee to the opposite shoulder. Just 10 light impulses just to warm it up a little bit. A lot of people ask me whether they should stretch first thing in the morning when they get up. No, I don't recommend that. I recommend at least waiting 20-30 minutes till you've been up and just warmed up a little bit. Even after the shower maybe would be best. And then I'm going to hold it here across the chest to the opposite shoulder for 30 seconds. And I did a heavy workout today, so my legs are really tight. This comes at a good time for me. And after we do that, we're going to place this leg down, lateral to the knee. And again, we're going to do 10 impulses just to open up the foramen in here where the nerve exits from the spine, stretch out the muscles in the glute, piriformis. And then we're going to hold it for 30 seconds, pulling the knee this way down towards the floor and trying to keep your pelvis as flat as possible. Great. And after 30 seconds, we're going to go ahead and bend this leg. And again, you can take your hand, grab your ankle, and push down to get a deeper stretch. And you're going to hold that for 30 seconds as well. Great. And now we did both legs. Those are the warm-up stretches for sciatica. Now we're going to get into the piriformis stretch. So what we're going to do is we're going to go back into that figure 4 position, and instead of pushing this leg down, we're going to reach through the legs, grab onto the knee, and pull the knee towards us. You can also do this against a wall and put your foot up on the wall, and as you get more and more flexible, you slide your butt closer to the wall so you don't have to pull with your arms here. This is the best way, I think, to start. And you hold that for 30 seconds. You're going to feel this stretch on this side right here, right where the piriformis muscle is. This is one of the best piriformis stretches out there. We're going to show you the second best one in just a second. So, take the hands, again, through the legs, clasp the hands over the knee, and pull towards you. And I think this side's a little bit tighter for me. And we're going to hold that for 30 seconds. Good. And the next one is a forward pigeon pose. Everybody knows that, and if you don't, I'm going to show you right now. This is a stretch. You can actually do it up on a couch, even something slightly off the ground, or on a massage table where you just put this one leg up onto the table and this leg would be down on the floor to make it a little bit easier for beginners. And you want to make sure your middle of your chest is right over your knee. And again, you're going to feel it in this area right here. And you're going to hold that for 30 seconds. And then switch to the other side. And again, chest, middle of the chest over the knee. And hold for 30 seconds. These stretches will get rid of your sciatica. If they don't, make sure you consult a chiropractic physician. And a little shout out to our veterans. I got my USA patch here. Thank you so much to our veterans, past and present. This is to honor you guys. I'm shooting this video on Veterans Day, so I just want to say thank you so much to all our veterans out there that may be watching this video, and thank you to all our subscribers and non-subscribers. I hope you subscribe, give us the thumbs up, and click on that bell for notifications. Take care, and I'll see you guys soon.